name is Kim Higdon, and I'm doing my health assessment video for health assessment class at OPSU. This is my patient, JC. She has agreed to do the video with me. Before we started the video, I did her height, her weight, her distance vision with the Snelling chart, as well as her near vision with the Rose bar chart. I'm going to start with her head. Looking at it, it's symmetrical, it's normal cephalic, it's in alignment, normal alignment with her shoulders. I'm just going to gently palpate it for any tenderness, any nodules, any tumors. Does that hurt at all?
No.
Okay, next we're going to move to her sinuses just to make sure there's nothing, she doesn't have any tenderness or anything with that. So we'll do her frontal sinuses, then we'll move down to her maxillary sinuses. Is that tender or does that hurt at all? So she doesn't complain of any of that. Her skin is warm to touch, it's moist, there's no fever with it, no rashes, no lesions, no nodules. Her hair is even, it's well groomed, it's reddish in color, it's evenly distributed over her head. It's coarse, well groomed, well taken care of. Next I'm going to move to her eyes. Her eyebrows are even with her eye canthus. I'm going to have her close them. She can close them. Her eyebrows, the hair is evenly distributed. Her eyelashes are normal. I don't notice any redness, any erythema, any drainage at all. I'm going to go ahead and do some, I'm going to check her cranial 5 and 7 nerves by having her do some things. I'm going to have her close her eyes tightly. Okay, raise your eyebrows. Oh, you can open your eyes now. Smile real big. Puff your cheeks out. Stick your tongue out. Take your tongue from side to side. So all of her cranial nerves up here intact. I'm next going to do the sensation touch. So I'm going to touch her and I'm going to have her tell me if it's hard or soft. Okay, her sensation is normal. Next I'm going to do the olfactory test. I'm going to have her smell something and I want her to tell me what it smells like. I'm sorry, I have to grab it. I left it over here. So can you tell me what this smells like?
Peppermint.
Okay, very good. So her olfactory is working correctly. Next we'll gently palpate her tympanomandibular joint just to make sure there's no clicks or popping. So I'll just gently palpate here. I'll have her open her mouth and close it. I don't notice any clicks. Does it hurt? Do you have any discomfort? Next we'll do her pupillary response, and I'm sorry my pen light broke today right before I did this, so I had to kind of improvise a little bit. So what we'll first do is we'll do consensual and direct. So this is direct and that's consensual, direct, consensual. And her pupils respond normally to that. I'm going to do the accommodation test. So I'm just going to have her look at a fixed area, and I'm going to have her just follow my finger. And her pupil, she's able to follow my finger. There's no problems there. Next, we'll do the 6 cardinal gaze test, and we do this to check for any strabismus or any difficulties with her eyes moving or any extraocular movement. So we'll start with this. I'll just have you look ahead. Don't move your head. Just try to follow my finger. And she's able to do that without any problems. There was no problem with that. Next we'll check her nose. It appears midline. There's no deviation. I didn't have an otoscope to use, but if we had one, you would turn it on, make sure the light works before you use it. You would put your covers on it, and there's a cover that goes on it. You'd put the correct size on there. And what I would do is I would I would look at her nose, and what we were checking for is to see If there's any deviation, we're checking to see if she has any any polyps, any erythema or edema. It all appears okay. I'm going to have her do the test, the sniff test, to make sure, you know, that she's able, that the patency is adequate. So I'll have her cover her right nose and sniff, left nose, and she's able to do that without any problems. I'm going to gently palpate her eyes just to make sure she has no tenderness with that. So I'll have her close her eyes. Do you have any pain with this?
No.
Okay, no pain there. And again, she has no drainage, no excessive tearing from her lacrimal ducts, and all that appears normal and intact. Next, we'll move to her ears, and again, I don't have an otoscope. I don't have an otoscope, so if I had one, you would put the correct side in, make sure it turns on. And how you assess her ears, you pull it up and back, and you look in, and you want to make sure the tympanic membrane is pearly gray. You want to make sure you can see all your landmarks. The cerumen, and I can use my flashlight and tell what that is, and it's clear in color, looking in there. I'm going to gently palpate her ears just to make sure there's no nodules. The skin, you know, color is even. There's no rashes, no nodules. I'm going to do the same over here. The ear cerumen is clear in color. I don't notice any nodules when I palpate. That's all correct as well. Next we'll move, I'm going to do a hearing test on her. So I'm going to stand behind her and do what we call the, I'm going to stand behind her and do what we call the whisper test. So I'm going to have her cover her left ear up.
Orange.
Okay, I'm going to have you cover your right ear.
Purple.
Okay, she seems to be able to do all that correct. Next, we're going to do the Weber test, and so how you do that is you take your tuning fork. I'm sorry, I'm trying to get where you can see me. Your tuning fork, you gently tap it on your finger, and you hold it up on there. Tell me when you can hear it and when you can't.
I can't now.
Okay, and so that's all intact. Next, we'll do the rind test. So we do that on the mastoid bone. And again, you tap this. And tell me when you can.
I can't now.
Okay, and we'll test again on the right side.
I can hear it.
Tell me when you can.
You can't.
And what you're looking for there is a 2-to-1 bone air conduction density test, and she did that, so that is correct. Next, we're going to move to her mouth. We want to, her mouth, her lips are pink, they're not dry. I'm going to have her open up her mouth, and I'm going to look inside it really quick. My pen light. Her tongue is moist, her buccal mucosa is clear and shiny. She appears to have 32 teeth with some dental work. They're pearly white. I'm going to take my tongue depressor, and I'm going to gently pull back and have her say ah. Her uvula should move up and down. She doesn't have any tonsils, so I don't notice any of that. Next, I'm going to have her lift her tongue up, and I'm going to look under her tongue. What we're looking for there is any sores or anything, because that can mean she could have some kind of mouth cancer or something like that, so you always want to look under the tongue as well. She's able to move her tongue. There's no problems. There's no lesions or anything on there. Next, we move to her neck. So her neck is midline. I don't notice any tracheal deviation. We're going to check her lymph nodes. And so how we're going to do that is palpate them. And let me get where you can see that. We're going to start with the occipital, and then we're going to move to the preauricular, the postauricular, the tonsillar, the submandibular, the submental, and then we're going to move down to the superficial anterior chest. We're going to move to the deep cervical chain, We're going to have her turn left to right with that, so turn your neck left to right. You should not be able to feel those at all. Then we're going to move to the interclavicular, and I don't notice any there. I don't notice any in the cervical chain. Next, we'll do her lymph nodes, her axillary, so I'll have her lift her arms, and we'll feel under there. Those feel okay. I don't notice any lymph nodes there. We're all good there as well. Next, we'll move, we're going to move to do active and passive range of motion with her neck. So what I'm going to have her do is touch her chin to her chest. I'm going to have her flex her neck back. I'm going to have her gently push against to the right, to the left, then to the right. I'm going to have her shrug her shoulders. Okay, and I'm going to have her turn her neck again right to left, and she's able to do that without any problems. Next, we're going to assess the anterior chest, and what we're looking for here is to make sure that she has a normal rate and rhythm when she's breathing, that she's not using any accessory muscles. She appears to be breathing normal. She does not appear to be using any accessory muscles. The skin is normal. I don't notice any cyanosis. I don't notice any barrel chesting when she's breathing. I'm going to check for her tactile vocal pharyngides, and how you do that is I'm just going to have her raise her arms for me, and I'm going to have her say 99,
99,
99,
99,
99.
99.
Okay, and that sounds good. And next I'm going to auscultate and listen to her lung sounds, and you would also check her sternum just to make sure she doesn't have any tenderness, you don't notice any nodules or anything there. Next, I'm going to auscultate her lung sound. So I'm going to start over here. I'm going to have her take a deep breath. Good. I'm going to have her take another deep breath. Good. Her lung sounds sound good. Next, I'm going to listen to her heart sounds. I'm going to start with the aortic and just breathe natural. I'm going to look to the pulmonic. Good. I'm going to move to her Erb's point. Good. I'm going to move to the tricuspid. And I'm going to move to the mitral valve. So what we want to make sure is that she has normal S1 and S2. You don't want to hear any gallops or any clicks, and I did not hear any of that while I was listening to her. Next, I'm going to have her turn around, so I'm just going to have her slide around. And I'm going to assess her posterior chest. And let's try to turn you this way. I know that's kind of, I got two video cameras. And so, first of all, I'm just going to gently palpate. I'm going to make sure she doesn't have any pain or discomfort when I'm doing this. Does that hurt at all? Okay. Next, I'm going to listen to breath sounds again. I want to make sure that she doesn't have any adventitious breath sounds at all. So what I'm going to do is just listen to her again. Breathe natural. And her breath sounds are clear. There's no wheezing. There's no adventitious breath sounds. She's breathing normal, moving air in all four lobes. Again, I'm going to check for tactile pharyngitis, and I'm going to just have her say 99 again.
99, 99, 99.
Okay, and that's all intact. Next, I'm going to gently do some palpation. I'm going to check and make sure I already did tenderness, so now I'm going to check and see if she has any hyperresidency or dullness by gently tapping here, 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 here. I'm going to do down here again to the costovertebral vertebral area, and you're going to use a little bit more force down here. And while I'm back here, I'm going to go ahead and check and make sure she doesn't have any tenderness in her kidney area. I'm going to palpate that gently. I'm going to push up and in and make sure that's all intact. All that appears good, so I'm going to have her turn back around for just a minute. I'm going to listen for her carotid arteries, and we're just going to make sure we don't hear any thrills or worries with that. First of all, I'll gently palpate them, just to make sure that I have a normal rate and rhythm, and that's good. So next I'm going to listen to them. And I don't hear any thrills or worries with that. I need to do her thyroid test. I did not do that, so I'm going to have her swallow. Go ahead and swallow, and you should be able to see the thyroid move, which hers does when she does that. Now we're going to move to the abdomen area. So I'm going to have her gently lay back. And I'm just going to move this out of the way. First of all, we'll just gently, it's soft. I'm going to just lift you up a little. I'm not going to expose you much. It's soft, it's round, it's non-tender, non-distended. When I look at it, the skin color is normal. Next, I'm going to gently palpate. Just tell me if any of that hurts. Doesn't complain of anything. I'm going to palpate the kidney on the right side, and I'm going to have her take a deep breath in so I can feel the borders of the kidney. You really can't feel them unless you have them take a deep breath in. The spleen is on the left side, and you should not be able to feel that unless it's enlarged, and I don't feel that. Something else I'm going to look for when I have her lay down is I'm going to have her turn her head to the right, and then I'm going to have her turn it to the left. I don't notice any JVD extension with that either. I'm going to listen to her bowel sounds now in all 4 quadrants. She has active bowel sounds. Her umbilicus is midline, it's inverted. Next I'm going to listen for her left renal artery, her right iliac, left iliac. I'm going to do right femoral and left femoral, and that's all good. No problems with that. I'm next going to have her set up, and I'm going to watch her abdominal muscles just to make sure that, you know, there's no exertion, that that's all normal when she goes to set up. Now we're going to move to her extremities, so we're going to move to her arms first. So I'm going to have her extend them out. I'm going to have her raise them up. I'm going to have her rotate them around. She has great range of motion. There's no problem there. I'm going to gently palpate to make sure she doesn't have any pain or tenderness. Her skin is even, it's warm to touch. There's no, it's not, you know, there's no lesions or nodules or anything that I notice. Her fingernails are well groomed. Her capillary refill is less than 3 seconds. I'm going to have her squeeze. She has great grip. I'm going to have her wiggle her fingers. She's able to do all of that. Next, I'm going to feel for her radial pulses, and I'm going to feel them at the same time just to make sure that they're equal and they're the same. And those are great. Next, I'm going to feel her brachial pulses, and I can feel them on both of those as well. She has no clubbing, no cyanosis of her fingers. They look really well. Next, I'm going to check her brachial reflexes. So I'm going to get my little hammer out, and I'm going to gently tap her, and that appears good. I'm going to do it on this side, and that's good. So her upper extremities appear good. There's no problems there. So next we'll move to her lower extremities. So we'll go to her legs. So first I'm going to gently palpate them, just to make sure she doesn't have any pain or tenderness, make sure I don't feel any nodules or anything like that. Those all appear well. I'm going to have her extend her legs out. I'm going to have her bend them. She's able to do that without any difficulty. I'm going to take her shoes off so that I can look at her toes and make sure she can wiggle all them appropriately. Go ahead and wiggle your toes. I'm going to pull her sock off down here and just check for capillary refill. It's less than 2 seconds. She can wiggle her toes. There's no clubbing. There's no hem or toes. They're well groomed, well manicured. I'm going to feel for her pedal pulses on the top of her feet. I'm going to do that at the same time just to check the rate and the rhythm and make sure they're palpable. Then I'm going to do the dorsalis pedal pulses. And then I'm going to move up to the popliteal pulses and make sure those are good. And all of those are able to be felt. Next I'm going to move to her popliteal reflexes. So I'm going to take my little hammer again and I'm going to make sure her reflexes are good. And those are good as well. Next we're going to move to, I'm going to have her stand up and I'm going to watch her walk to watch her gait. So I'm going to have her walk that direction and then turn around and walk back. Okay? And then I'm going to have her turn around and gently bend over. And I'm going to feel the curvature of her spine to make sure that's normal. Make sure I don't feel that it's in normal alignment. I'm going to check to make sure her chest is concave. And that's all good. Did you have any pain when I did any of that? No. Okay, go ahead and stand up. Last thing we'll do is I'm going to have her stand here on one leg and I'm going to have her close her eye. Okay, she was able to do that without any problems and I'm going to have her do it with the other one. So her gait was normal. She didn't have any problems with any of that. She was able to walk without any difficulty. And this completes my assessment for nursing assessment. Thank you. I don't know how to stop it.
I got that one stopped. Did you stop it?